Hello, we're going to look at the thyroid gland here. And before we start, I think it'd be good to just recap on the anatomy. And what we're looking at here is the thyroid cartilage, of course, followed by inferior to it, the cricoid cartilage. And here I'm drawing for you the thyroid gland. So it's composed of two lobes, the right lobe and the left lobe, and the isthmus in the center. And over here, this is the trachea with the rings of cartilage. Occasionally, there may also be a pyramidal lobe just about the region. Usually it rises over the isthmus. And the very important structure here would be the nerve, the recurrent laryngeal nerve, which actually hooks and goes behind the thyroid. So sometimes thyroid conditions can actually compress on it. Now, the normal thyroid weighs about 20 to 25 grams. It's a little bit heavier in women compared to men. And enlargement of the thyroid can sometimes compress upon the trachea and give rise to difficulty breathing, stridor, or also even swallowing sometimes by pressing on the esophagus posteriorly. And also, as I mentioned earlier on, if there is a goitrous enlargement, this can compress on, or if there's a tumor in the thyroid, it can directly invade into the recurrent laryngeal nerve, giving rise to hoarseness of voice. So this is a possible clinical presentation as well. Now, having looked grossly at the anatomy and structure of the thyroid, now we're going to quickly have a look at the function. The thyroid gland has an important function in terms of metabolism. The thyroid hormones serve to regulate our basal metabolic rate and heart rate, appetite, actually the weight of the patient because of the catabolism of nutrients such as carbohydrates as well as lipids. These are all affected by thyroid hormones and also protein synthesis. Another important function is growth and development as well as maturation, especially in the CNS. So when there are congenital or developmental thyroid problems, for example, if there is aplasia or hypoplasia of the thyroid gland, where there's insufficient functioning hormone, the patients or the children will usually be very short in stature, and they may also have mental deficiencies. And we use the term cretinism for such patients. This is an example of a picture, and you can see that the height is actually short. There is a very obvious goiter here. And usually these patients, as mentioned, will have mental deficiencies. So it is very important to pick up the state of hypothyroidism at birth so that the thyroid hormones can be given right at an early age to ensure proper growth and maturation. Now, these functions stem from the thyroid hormones themselves, T3 and T4, or triiodo and tetraiodothyronin, and these are produced by the follicular cells, which form the main bulk of the parenchyma of the thyroid gland. Now, the thyroid is part of the endocrine system, and there's an important sort of hierarchical level by which these organs are controlled. So what controls the production of thyroid hormones by the thyroid gland would be the pituitary gland in the brain, and this releases the thyroid stimulating hormone, which stimulates the thyroid to produce T3 and T4. This pituitary is in turn regulated by the hypothalamus, which produces thyrotropin releasing hormone. TSH is also known as thyrotropin, and this in turn influences the function of the pituitary in terms of how much TSH to release, and again this in turn affects the follicular cells. So if we have a condition that gives rise to abnormal thyroid function because it is due to the follicular cells themselves or because of thyroid hormone under or overproduction by the follicular cells, this is known as primary disease. And if it's at the pituitary level, it's known as secondary disease. And how do we differentiate these? We look at the blood levels of TSH as well as thyroid hormones. Now, if you recall, there is yet another type of cells in the thyroid gland in addition to follicular cells, and these actually release calcitonin. Calcitonin is important in metabolism of calcium, and these cells are known as the parafollicular C cells. Calcitonin helps to reduce the loss of calcium from the skeletal tissue or from the bones. Knowing these two main cellular components helps to tell us the types of tumors that also arise in the thyroid.